families. Thank you so much for joining us as we delve into the findings of our 2022 Campaign for Inclusion research series. The report sheds lights on the experiences of military families of color and of diverse military families and offers insights on how we can work together to build bridges of belonging together. I want to express my gratitude to IVMF, who is with us here today, for their partnership in the important work we do on this survey and on our annual Military Family Lifestyle Survey. I'd also like to thank everyone who is joining us today. Your presence helps us underscore the importance of our work to this key element of our community. We need to all come together to support all of our veteran and military connected families. For those of you who are not able to join our earlier main event with our service partners from the various military services, those panels will be available online later today, and we hope you will take the opportunity to watch them at your leisure. We're honored to have with us today Major General Juan Ayala, retired, a distinguished member of Blue Star Family's Campaign for Inclusion Leadership Committee. As a retired Marine officer with over 30 years of military experience, Major General Ayala has dedicated his career to advocating for those who serve and for their families. He is in an important position of leadership in the city of San Antonio. We are really honored and grateful for his service as a leader to us in this work. Welcome, Juan. Thank you so much for joining us today.
Thank you, Kathy. Thank you for that warm introduction. And I really am honored to be here as a retired, not only as a retired Marine Corps flag officer, but a member of the Campaign for Inclusion Committee and an advocate for military families. I've been an advocate for military families for many years, active duty, and now with a veteran connected community here in San Antonio. As Kathy said, I did spend 36 years on active duty in the Marine Corps, retired in 2015, and was immediately hired by the city of San Antonio, and I'm currently their Director of Military and Veteran Affairs. So I've been with them now for 7 years, which is a long time for a retired flag officer of my age. And San Antonio is appealing to me because I'm very familiar. I used to be an installations commander. I'm very familiar with the importance of communities engaging with their military commands, but it also works both ways. I'm also very familiar with the military reaching out to our men and women that are on our bases. 85% across the board, across all our bases around the world, of our military families do not live on base. They live off base, and so they live in the community. So I think it's really important to highlight some of the things that San Antonio has been used as an example to include. We're one of the first, we're only the second city in the nation that funded spouse employment for active duty. Now we're doing it for veterans. We also do a work program for them. And we continually partner with our military to take care of our families and to know what their needs are. We're military USA, we certainly understand it. And we're so connected with our military community here that one of the mayor's opening lines when he talks to any audience, whether it's in the Pentagon, and I take him to the Pentagon at least once a year, is that the military is in the city of San Antonio's DNA. And you got to remember, this is the 7th largest city in the nation, and we host the largest joint base in the Department of Defense. One of the takeaways from the findings, and I was mentioning this earlier, was all the work we still have to do. I mean, there's a lot of details, and we'll go into them further. The team will go into them further. There's a lot of work. We've done a lot of work. It's been a long way since I went to OCS in 1976. 2023, a lot to do. But we have, I think, with CFIC and some of the folks that have been participating and supporting us, I think that's we're getting there. We're gonna be fine. So we're very military friendly, and when I go to the Association of Defense Communities, I really pound that home, and I think most of our communities are beginning to understand, because of CFIC and other organizations, that we really do need to reach out as communities. And I'm a member of CFIC because I want to see that. I have I have personal vested interest in this. I have a daughter on active duty, 2 sons-in-law on active duty, and a niece and a nephew on active duty, plus a ton of friends and that have been on active duty before. So again, there's a lot of work to do. And what I want to do at this point is I want to thank the military connected families who took the time to take that survey. Your input, your experiences are very valuable, and they're going to be used to make meaningful change, not only today, but long after I'm gone and in the future for those that are still on active duty and those families that are out there. So thank you very much. And now let's dive into the data with Blue Star Family's applied research team and explore how we best can go forward and support our military families. And thank you for joining us today. Over to you.
Thank you so much, Major General Ayala. We are excited to have you join us this afternoon for our data deep dive, where we will present some additional data findings from our Campaign for Inclusion research series, Building Bridges to Belonging for Military Families of Color. While the research team selected a handful of data points for the main event panels, we have much more to share with you today. Our 3 goals for this session are to present more relevant data, answer your questions, and facilitate a discussion. As always in our deep dive sessions, we encourage you to ask questions and engage in discussion, but please keep in mind that some questions may require further research or may not be able to answerable due to small sample sizes. Nevertheless, we appreciate your questions as they can guide us for future survey iterations. So speaking of which, I am excited to announce that Blue Star Family's next survey will launch on May 24th, and we will love your help in sharing it widely so we can continue this important work. If you have any questions, please feel free to type them in the chat, and we have several team members available to respond. Please be respectful and considerate in framing your questions as we want to ensure a safe and welcoming environment for everyone. Finally, a friendly reminder that this session is being recorded. Thank you for joining us, and I will now hand it over to Dr. Jessica Strong for an overview of the findings.
Thank you, CT. So delighted to be here today and to be able to share a little bit more of our data with you. Our Associate Director of Policy, Brooke, is sharing the screen, so sharing the slide deck with us so I can tell you a little bit more about what we found. So let me start with an overview of what we are trying to do with this research. So this research project had 3 aims. One, we wanted to look at the experiences of racism and discrimination on 3 outcome variables. The first outcome variable is looking at the impacts of these experiences on respondents' sense of belonging to the local community. We know sense of belonging is critically important for resilience and critically important for just individual and family well-being. So that's why we wanted to look at that. We also wanted to look at the impact of these experiences of racism and discrimination on families' willingness to recommend the community to other families like theirs. So it's important as we are looking at states are looking to recruit and retain military and veteran families to either stay in their state after military service is complete or relocate to that state after military service is complete. And as if military families are not willing to recommend communities to families like theirs, they're also probably not willing to recommend living there or staying there or moving there after military service is complete. So it's important for the economic benefit to the state to know where military families are, what communities are being recommended. And then we also wanted to look at the impact of these experiences on willingness to recommend military service as a whole. As you may have heard on our panels today, some of our panelists talking about the importance of the all-volunteer force, and that our most service members today come from military families with a tradition of military service. As fewer and fewer Americans are serving in the military, we have a smaller and smaller pool to join from. As you heard on the panel, in 1960, we had something like 40% who had a parent who served in the military. Many people served during World War I and World War II. And as we've progressed further, that number has dropped to just over 13%. So it's important to understand military families of color, their willingness to recommend military service as a result of some of these experiences. So I wanted to look at the impacts of these experiences on those 3 things. And then we also wanted to look at what are the community attributes that encourage people to have a sense of belonging and create the condition under which military families can feel a sense of belonging to the community, because that is so important. So talking a little bit more about why we started this work to begin with. As you may have heard before, we started our Racial Equity and Inclusion Initiative back in 2020 after the murder of George Floyd, looking at the issues of military families of color. We have since expanded that to look at Campaign for Inclusion, to include not just issues of race and ethnicity. But these are important issues because we know that 3 in 10 of our service members today identify as a racial or ethnic minority, and in 4 years, by 2027, most recruitable adults between the ages of 18 and 29 are going to be people of color. So this is an issue that will clearly affect our future force. Furthermore, it's not just the current service members or potential future service members, but it's also their families. 1 in 4 of our active duty family respondents identify as a member of a multiracial or multi-ethnic family, meaning that they have a spouse or children who are of a different race or ethnicity than they are. So this is a quarter of our families who have multiracial and multi-ethnic families and are considering these issues. Next slide, please, Brooke. So now a little bit more about the research. This last year in 2021, we fielded a survey that was specifically for military and veteran families of color, and released it in 2022. That was a standalone survey specifically for military and veteran families of color. This year, we wanted to incorporate those questions into our annual flagship survey, the Military Family Lifestyle Survey. So we included those research questions into our 2022 Military Family Lifestyle Survey and garnered a population of over 4,000 active duty family respondents, of whom 1,100 are active duty family respondents of color. Now, it's important to note here that this sample may not be generalizable to the entire military population because it's a convenient sample, but it still offers some really important insights about the relationship between experiences in the community and military life. So next slide. Speaking of those experiences, we wanted to start off the research with just understanding what are the experiences that people are reporting, that respondents are reporting this year. So this year we asked about 5 specific types of racial or ethnic discrimination experiences. Those are listed on the slide that you have in front of you. And we asked about respondents' experiences with these incidents in both the civilian community and the military community. You can see that in the civilian community, the incidences are reported at greater rates. So almost 4 in 10 of our active duty family respondents of color reported that they had feared for their personal safety because of their race or ethnicity. They were subjected to racial ethnic slurs or jokes, or, as you may have heard on the panels, almost 4 in 10 had reported that they had a child who experienced racially or ethnically motivated bullying in their current civilian community. And while these numbers by themselves may be surprising, what is more surprising or more important maybe, is that most respondents who experienced these things didn't disclose it to the military or civilian officials. As you heard, it's important for this disclosure to happen, to create the environment in which this disclosure can happen so that these issues can be addressed. Next slide, please. I think we need to go to the next slide. Thank you. So, as I mentioned at the beginning, one of the important pieces of this was looking at how these experiences, these 5 types of discrimination that you see that we asked about, how those impacted community experiences. So how they impacted the respondent's sense of belonging and their likelihood to recommend the community. Well, it may be unsurprising that those who experienced any of these experiences of discrimination, any of these instances, were significantly less likely to reported significantly less belonging to the community than their peers who had not experienced it. And the same pattern was true for their likelihood to recommend the community. Those who had experienced any one of these incidents also reported that they were significantly less likely to recommend the community than their peers who hadn't experienced it. And another piece that was important here is that not only was it true for respondents who had experienced any of these things, but it was true for each individual type of experience that we looked at. So the pattern held regardless of whether it was any of those experiences or each one of those. So those who had experienced their child reporting racial or ethnically motivated bullying, significantly less likely to report a sense of belonging, significantly less likely to report, to recommend the community to families like theirs. Next slide, please. Then we looked at that same pattern, at that same relationship for these experiences and families' likelihood to recommend the military service to a young family member. And the same pattern held here. Respondents who reported any one of these incidences of discrimination or racially, ethnically motivated discrimination also were less likely to recommend military service to young family members. It's important to note that this was regardless of whether they experienced these things in the civilian community or the military community. So this could have occurred, as in the example in the panels, at Hill Air Force Base, in the schools or in the school district, in the civilian community, still has an impact on individuals and on their likelihood to recommend military service overall. Next slide, please. All right, so once we looked at the impacts of those experiences on those 3 outcome variables, we also wanted to look at what are the circumstances, what are the conditions, what are the characteristics that contribute to developing a sense of belonging to the community. So last year we looked at regions, and we had 20% of our active duty family respondents of color reported that they were not at all likely to want to live in the South. And that was at the region. So we wanted to take a little bit of a closer look there and say, are there certain states that are doing it really well, that have the conditions for belonging to the civilian community, that have the conditions for families of color to want to recommend them to other families? So we aggregated the data by state and looked not only at the belonging and the likelihood to recommend the civilian community, but also military family lifestyle, cultural competence in that community. And I'll go into that in a little bit more detail in a moment, but we looked by state at the diversity, the racial equity index, the number of military installations, the proportion of active duty service members as part of the state population, to see, do any one of these things create the conditions for belonging for military families? If the state is more diverse, do families of color feel more belonging there? If the state is more racially equitable, do families of color feel more belonging? If there are more military people in the state or veteran people in the state, are those the conditions for a sense of belonging? What we found is there wasn't one single characteristic or one single state that stood out as different from the others. So each of the belonging is a little bit more complicated than that. It wasn't one single characteristic, and there wasn't one state that was better or worse than others. So it's much more complicated and complex. But one thing that was associated with that sense of belonging to the civilian community is military family lifestyle, cultural competence. Now, what we mean by that is that the respondents perceive that civilians in the community understand, appreciate, respect, support, and value military and veteran families. So if you feel understood by your civilian community in that military and veteran culture, then you are more likely to also report a sense of belonging to the community, and you're more likely to recommend that community to other families like yours. So these 3 things are all correlated with one another. Next slide, please. We also asked respondents, what is it that contributed to your sense of belonging? When you think about, we asked respondents, when you think about the community in which you felt the most sense of belonging, what was it about that community that helped you feel that? So for both active duty family respondents of color and their white peers, it was that most people understood, were aware of, appreciated, respected, and supported military and veteran families. That military cultural competence was the top contributor for over half of both groups that we looked at. The other things that were important to develop a sense of belonging were having friends and people to ask for a favor, feeling that your community was safe, and having your children have the opportunity to have friends. One thing that was a little different, though, was for military families of color, perceiving that the community embraced diversity was another critical piece of it, much more so than for families, but then for their white peers. So 34% of our active duty family respondents said that having a community that embraces diversity is an important piece of feeling a sense of belonging to that community. So next slide, please. So this is an overview of some of the findings that we have. I encourage you to dive a little bit deeper into the report itself. And now we can turn to asking some questions. Over to Brooke to start the question and discussion portion.
Thank you, Jessica. So we have a few questions, and hopefully we are going to open up to the gallery to have our analysts sharing the discussions with us. But my first question is for Jessica. Why did you call this event Building Bridges to Belonging?
Thank you, Brooke. I appreciate the question. This really came out of the research. So we at Blue Star Families try and drive everything that we do in the research and base it in the data. And so the title for the event even came out of the research. When looking at those community attributes that build a sense, that set the conditions for a sense of belonging for military families, when I was looking through the data, it was a couple of things. Is it having other people of color, having diversity in the community that helps bridge to belonging, that gives you a commonality with other people in the community on which you can feel that sense of belonging? Is it military family cultural competence that gives you something in common with others? I think that when people develop a sense of belonging, it's because they have something in common that helps them build a connection. You heard in the panels people talking about connection and the importance of maintaining that connection, but we need something to connect on. For some people, we found in our previous research that for some people, just having a kid in school builds opportunities to having a kid in K-12 education builds opportunities to connect to other parents, to other people in the community. And those who have kids in K-12 education feel more belonging to the community than those who don't, because they have a bridge to connect on. And I feel like it's the same thing for many other types of bridges. It could be having a person who looks like you, who is the same religious background as you, who has similar hobbies and things that they like, activities that they like to do. If you have something to connect on, whether it is your military experience, whether it is having children in school, whether it is going to the same church or the same religious experience, then you have something to bridge that gap and build a bridge to belonging. Back to you, Brooke.
Thank you, Jessica. That was very insightful. My next question is for Rosie from IVMF. How does this report build on last year's research?
Okay, so last year we conducted a comprehensive needs assessment specifically focused on the experiences and perspectives of military connected individuals of color. So the service member, the military family, veterans, and their families. So this is, I call a foundational study because there was no existing research prior to that included all the perspectives of military connected individuals of color, as well as covering such a wide range of topics and issues. Now, we used last year's work to inform and identify priority areas for this year's report. So I think Jess had mentioned, we really narrowed our focus to active duty families. We investigated specific incidences of racial and ethnic discriminations and community level attributes, such as a sense of belonging to civilian communities that military families PCS to, as well as recommending military service overall. We really wanted to understand how these experiences of belonging for military families of color impact outcomes, such as recommending that community, as well as recommending service. I also want to say that because we focused on communities, we were able to feature a few state profiles and case studies as well.
Thank you, Rosie. My next question is for Ms. Ashley Scott. What are some of the policy wins from last year's research, and how are this year's recommendations building off of those?
Yeah, thank you, Brooke. Well, as Rosie mentioned, last year we had a really broad and very impactful survey that we briefed to so many folks and lots of people across the government and across the federal government, across local governments and communities. And we had two specific wins that I'd like to highlight. The first is that in last year's National Defense Authorization Act, Congress included some language requiring that DoD collect data about the ROTC scholarship program. We asked them to introduce this data because we realized that no one understood why or whether or if there was a difference in the reception of ROTC scholarship funds between based on gender, based on race and ethnicity, et cetera. And so we think this is an important way to gather data, which was one of the guiding policy principles that Blue Star Families has and our policy team has. The other win that I'd like to highlight is that for the first time last year, the Department of Defense specifically included military families in their equity action plan. And we see this as a huge step forward in the military world, that there is this inclusion of military families, and in this case, specifically marginalized or military families from marginalized communities. We've also seen some positive steps taken by all types of stakeholders, including state and local governments, as well as additional federal agencies, schools and school districts and more, which really leads us into how we're building this year. And so this year we're continuing to dive deep into communities rather than focusing on the federal government or DoD, because we know this is an issue that the government can't solve alone, that really requires communities to become involved. So we have policy recommendations for communities, for community organizations, for individuals, for civilian and military leadership, for school districts and more. And so this is really another step forward in our sort of cross-sector, whole of community response to the issues of discrimination that we talked about in this report, that really go towards not just military readiness, but ensuring that our military families are thriving. So back over to you, Brooke.
Thank you, Ashley. My next question is for Jessica. Do military families of color report experiencing more racial or ethnic discrimination in this year's survey than in previous years?
Thanks, Brooke. That's a really important question, and trying to look at trends over time and seeing whether is this issue getting better, is it getting worse? We know that as you heard on the panels, we know that the services are really looking at these issues and working and addressing them in a variety of different ways. So I want to see, is that actually getting better? Are we seeing any improvement? Unfortunately, with the way we have the questions worded in the survey, it is really difficult to add. There are a couple limitations that prevent us from really answering that question very well. One is the nature of the survey. It's a convenient sample. We can't guarantee we have the same sample from year over year. As I mentioned earlier, it's not generalizable. It is a convenient sample that offers insight, but isn't something that isn't indicative of being replicable across the services as a whole. So one is that sample change from year to year. We don't know that we have the same people year over year. If we had a true longitudinal study where we could take the same panel of people and follow them over time, that might offer us some insight into whether the problem is getting better or getting worse, or sort of where we are with it. Another additional challenge to answering that question is how we ask questions in the survey. So whenever we do the survey, we redesign the questions each year to get at a different specific research question. So we don't have it asked the same way from last year to this year, or even in previous MFLS surveys where we've asked about experiences of racism and discrimination. So it's not possible to compare year over year to this date, these reports to one another, but taken collectively, they still offer a lot of insight into how these issues how experiences and issues are impacting people and maybe changing some of the decisions and behavior that those families and respondents have. So unfortunately, we don't have an answer as to whether it is getting better or worse, but we do know that we were able to compare a few subgroups this year and found that there were a greater proportion of family respondents of color who reported experiencing all forms of racial or ethnic discrimination than white respondents who are not in multiracial, multi-ethnic families. So we have a few opportunities for comparison, but not year over year, unfortunately. Thank you, Brooke. Back to you.
Thank you. My next question is for Ashley. You found that respondents listed the same communities as the place where they lived, where they had the most and least belonging. Why do you think that is?
So we really think that that's because those are the popular locations, by which I mean lots of people are living there, right? So it will be the Virginias, the Californias, the Texases, right? Where there is just a large population, a large military population. And this implies to us that there are these distinct experiences even within the same communities, right? And I am very lucky to have grown up in Norfolk, Virginia, which is home to the largest naval base in the world. And I think from my perspective, but also based on the data that we have, there are people who are having amazing experiences in Norfolk and around Hampton Roads, and other people who are not. And so this tells us that this is not just a complex issue, but one where maybe even pockets of certain communities are sort of plugging in and doing the right thing, and others need some more help. And this really, to me, continues to highlight and speak to something else that stands out in our campaign for inclusion research and everywhere else that we're reporting out this data, which is that regions, states, even these bigger communities with military locations can't be reduced to one experiences. I know, Brooke, you referenced last year's report, which was titled "The Diverse Experiences of Military and Veteran Families of Color." And that to me really speaks to what came out in the data this year, which is that even within specific communities, there are those diverse experiences, and there are communities and groups that are doing an amazing job of welcoming military and veteran families, and groups that need some help. And I think that this data gives a good first step in exploring more deeply what those specific characteristics of these pockets of communities are.
I wanted to, not to put you on the spot, but to put you on the spot. I wanted to follow that up with, did we come across community-based organizations that are explicitly and intentionally working to advance DEI in partnerships where families are using on-post schools, services versus off-post schools and services?
Great question. And I saw a very similar question in the chat, which I was just about to respond to. And the answer is we are working on it. We have been sort of introduced to some of those organizations. I was going to write that some of the briefings that we were able to do this year before we published the report were with those liaisons in communities who are already doing a good job of plugging into the community organizations, the local governments, and the military communities where these efforts associated with belonging are really at the forefront, right? And associated with inclusion. And so I can't speak of any off the top of my head, but I will say that this is an area where we'll be diving more deeply into it and really looking to partner with and understand better those organizations that are doing that work on a local level, because as this report has shown us, that is where the change really can be made, and that's where the impact can be made for our military families.
Excellent. Thank you so much.
Can I
Jess,
also
did
jump
you
in there?
wanna- Yes,
I do.
go ahead.
I do. I wanted to jump in there because I saw the question, and Ashley, you did a beautiful job of answering. I think I would only add that there are some examples of communities that are doing really good work that we included in the report. San Antonio is one of them. Point to San Antonio as Military City USA. We point to and some of the needs assessment that has gone on, and in San Antonio point to the Northern Virginia. I'm going to lose the name of it, but Ashley will remember and she can drop it in the chat.
The Northern Virginia Regional Commission. Yes.
Thank you. That's the one. I lost the name of it, but I knew it was Northern Virginia. They've actually come up with this with a roadmap that provides a clear roadmap of how they're addressing these issues and involving military and veteran families. So there are some communities that we can draw best practices from. And I will add, in addition, tomorrow we have a small, intimate, in-person closed door session where we invited some of these stakeholders together to talk about these issues and figure out some recommendations for next steps. We have some recommendations, but this type of work in particular is community-based, and we need to bring in stakeholders within the community that can bring those solutions that can be replicated elsewhere. So we're going to publish a report from similar to, but related to the work that we just published today, but we're going to share some of those best practices as well after that closed door session. So I look forward to digging in more of the, we're just really starting this. We definitely don't the table to bring together the answers.
Thank you so much, Jessica. This next question is for you. Last year, we found that 20% of families of color were not at all comfortable being stationed in the South. Did you find some regions or states are better than others this year?
Thank you for the question. I'm also going to use this to answer another question that I saw in the chat, which was, I think Hugo asked if there were things that surprised us. So this was one of the things that surprised me when I was doing the analysis for this. I'm looking at the states and thinking, certainly there are definitely going to be some states that create the conditions for a sense of belonging more than their peers. So places that have a lot of military and have a lot of diversity have to be well above, like places like San Antonio, Texas, places like Virginia, places like North Carolina that have a lot of military and a lot of diversity. Those are going to be the ones that create the conditions for belonging. And I was surprised to see that there really weren't any states that were above or below the we clustered around the mean. So it just goes back to there are the diverse experiences of military families. We have to get down to at minimum, the community level, if not the individual level, to figure out what is it that creates the conditions for belonging for that individual or that community. So we can't look at it by the state level. So there weren't any states that were better or worse than others. There weren't any regions that were really better or worse than others. We had some differences in experiences by region, but those could be possibly because of sample sizes that were smaller in some areas. But those were some of the things that surprised me. I thought we would have a clear indicator that more diversity, more military means more belonging, and it's just more complicated than that. So thank you for that question.
Thank you for sharing. So my next question is for Rosie again. Could you tell us more about the sample? Is it generalizable? What are some things we should consider when looking at this research?
Yeah, really quick, I want to piggyback on Jess's previous comment really quickly. I was just going to add that the experiences are definitely within the community, but is ultimately how the individual reacts and perceives it, I guess, and perception is really important. And there are individual differences even within a community. So do you want to also add another layer of complexity to that? But okay, so is the sample generalizable? And Jess did have a slide earlier in the presentation. And we always say that the sample is a convenient sample. We used a snowball sampling strategy, which really means we relied on our network and our partner and people that took the survey, their network and their partner. But we did make intentional efforts and outreach efforts to ensure that we're not missing the perspective of military families of color. And that was extremely important because most other surveys don't include that extra layer. But we also acknowledge that the results are really influenced by whom responds to the survey. And we actually did find some differences by branch and rank. We do have a very comprehensive methodology and limitation sections in the report, and we're transparent about that. Now, with all of that said, I will also say that it's really difficult to say that the sample is generalizable because our understanding of military families of color is extremely lacking in terms of the data that's available. And we really just don't have a solid understanding of their perspective, their experiences overall. So I can't say any study who is focused on this is truly representative because ultimately there's so much data gaps out there, especially on the military family's perspective.
Thank you for sharing that information, Rosie. My next question is for Ashley. What are the characteristics within the communities that respondents reported contributed to their sense of belonging?
Of course. And I think also I saw in the chat, someone asked the same thing. And I know Jess covered it, but I just wanted to highlight again that The top 4 characteristics that we saw were the same for military families of color and for white, non-Hispanic, non-multiracial families. So first, that was military family lifestyle cultural competence. And when we asked the question, it was specifically phrased as most people understood, were aware of, appreciated, respected, and were supportive of local military and veteran families. That was the top reason for both military families of color and white military families. The second reason was that respondents had friends or people to ask a favor of. The third was community safety, that their community was safe to live in. Fourth was that their children had friends, which goes back to Jess's point about military children or having military kids in schools and finding connections that way. But the fifth reason was where we saw the distinction. So more than a third, 34% of military families of color said that having community members embrace diversity was a key characteristic that made them feel a greater sense of belonging. And only about 16% of white military families said the same. And I know in the chat, there was a question about whether this was less important or less necessary. And I would say that we sort of see it not as a question of importance or necessity, but more of one of those bridges to belonging that Jess referenced earlier, right? That if you come into a community and it's diverse, and I'll use a perfect example, like my brother and my dad go to the barbershop. And if you can find a barbershop that caters to your type of hair, then you're likely to feel a sense of belonging in that community, right? Versus you can also be in a military community, right? Where it isn't necessarily as diverse as you were expecting, but because there's this understanding of the military lifestyle, that's another bridge to belonging. And so I think that for us, this really shows that embracing diversity is a key way for communities to better welcome, to better help military families feel like they belong around the country. And this, to Jess's earlier point, we see as tied not only to recruitment and retention in the long term, but also to the attractiveness of communities for military families, for veteran families to retire there, and additionally for the military itself when it is making decisions about where to have particular commands or anything like that. So there was, we have that slide on there. We also delve into that further in the report, but I really appreciate that question because I think it lays out how these bridges to belonging can differ across populations, but each can be an important lifeline for military families when they move to a new community.
Can I just add that Ashley said that way better than I could? That is exactly what I was trying to say earlier and couldn't get it out. Well stated. I also want to add on one of the things that we saw that was a barrier to belonging was not having culturally appropriate food and services. So it's a great example that you bring up, Ashley, like just having somebody who understands how to do your hair or where you can get food that is what you typically eat and what you would eat at home. They seem menial, but they're important signals and indicators of that you belong here, that you are part of this community because we have what you need and we include you. So back to you, Brooke. I just had to add on to what Ashley was saying.
No problem at all. It was great conversation. So the next question we have comes from the chat. The question states, were there any indications of belonging that also followed trends of health, i.e. social determinants of health? Are communities of belonging also more healthy communities for marginalized service members and families? So I'll open that up to all of our analysts.
I'll take the first stab, but I'm definitely open up to Ashley or Rosie if you want to pitch in here. I would love to hear your thoughts as well. So in this particular survey, we didn't ask about social determinants of health. We didn't do the analysis for social determinants of health to determine whether there are communities that have greater neighborhood and built environments or have a better social and community context. We didn't look at those things to see whether they also have a better sense of belonging. I would hypothesize that is probably the case because if you have the services that you need, if you have the things that you need to be more resilient and just generally healthy, like if you have mental health care access, if you have a good school where you're not, your children don't experience racially or ethnically motivated bullying, though chances are you will also probably feel a greater sense of belonging to those communities. That's my hypothesis, but we don't yet have research to back that up. Our next iteration of research is looking really at the community level, and that's the intent, is to we looked at the national level, we looked at state level, now we got to dive into communities and individuals. So that is, the social determinants of health are a lens through which we want to look at a lot of our research, but we just don't have that yet. So I appreciate the focus. Opening it up to Rosie or Ashley if you have something to add there. If not, that's okay too.
No, the only thing I think I was gonna add is, yes, that's a really good future research opportunity to embed. And certainly we can look on not just this past years, but the previous years to see if we can be able to ask that. But I will also say, at least in the veteran space, you do have a lot of research on social determinants of health, racial health equity, access to care, quality of care, and such. And so I do think that there is a lot of exploratory opportunity in overall.
Wait, sorry, I don't have a specific answer to the question, but I did want to jump in from the
Yes,
policy
please do.
perspective, because for us, access to the social determinants of health, right? Access to those resources and to the things that you need to thrive is a key factor in our policy priorities and our policy recommendations. And this is something that Brooke and I, as members of our policy team, are always looking at essentially ways to advance access to those types of things that people need. And so just wanting to say that I am echoing Jess and Rosie in that it is an area for future research, but also just want to highlight that it is also an area of ongoing advocacy at Blue Star Families to ensure that all military families and military families of color have access to the resources and the things that they need to thrive.
Can I add in there? Sorry. I'm just jumping off of what you guys are saying too. I saw Will's question in the chat, which is U.S. Surgeon General Vice Admiral Vivek Murthy, I hope I'm pronouncing that right, released an advisory today on the epidemic of loneliness, reporting that 1 out of 2 adults and many across all ages lack meaningful connection and belonging, talking about significant risks to health, performance, productivity, etc. The advisory underscores it's critical to address lack of connection and belonging for health and wellness. That's what we're talking about here. That's why we focus so much effort on belonging, not only belonging for everybody. Belonging is to the community is a key research question for Blue Star Families as a whole in our military family lifestyle survey, as well as in our campaign for inclusion. So we're not talking about belonging, it's belonging for families of color, for diverse military families, for families who have different sexual orientation, for families who have kids who have different sexual orientation, so that it is inclusive for everybody, the campaign for inclusion, so that we can all feel like we have a sense of belonging. So I wanted to highlight that. And it looks like, oh, sorry, there's an answer to a question in the chat.
There is another question that came up in the chat, and it is rather interesting and something that I don't often know if we think about, but do we support foreign organizations and study centers that care about the history of veterans and caregivers for their families abroad?
That is a really interesting research question. It's not one that, or a question, I tend to default to research questions, and it's not one that we have talked about typically. Our work at Blue Star Families tends to focus on U.S. military families and veterans and where they are all across the world. So we often have respondents who are stationed in different countries all over the world. So we tend to focus on the American military. We can make some key targeted recommendations around that because we understand what the policies and regulations are. Rosie, did you have something?
Yeah. So I also want to add that there is ultimately a lot to learn, especially from various other company or countries in particular. So I know that here at the IVMF, we do have partnerships with other countries, Australia, UK, Canada. Certainly look at their research. We talk about our research. We share our research and take, ultimately, there are a number of briefings. It's about shared best practices, what works there, what can work here. There's incredible overlap in the, especially the transition experience and certainly the care thereafter, especially in most post-military life. So we take that, we learn, but we also informs our work collectively. So I will say that there's always a constant partnership of some form.
And then I just wanted to jump in. It's not quite on the subject of the question, but it has to do with foreign-born spouses. And the fact that part of Blue Star Family's efforts in the past years have been to expand access to our research and to our programming. So our MFLS now is offered not just in English, but also in Spanish, as well as I want to highlight one of our colleagues, Laura Torres, who runs Spouse Force, as well as our equivalent Spanish language programming. And so this is an area where, where we are just trying to make sure that our programming, that our research is accessible to folks who might not be like us, right? This is part of the way that we are trying to make sure that our data is accessible and equitable and serves the population whom we care about, right? These diverse military and veteran families who make up our communities and live with us and among us, or are us. So yeah, just wanted to add that in.
And piggybacking off that, we have, and she didn't know I was going to highlight her, but I'm going to highlight her. Lydia Owiti is our Deploy Fellow who is focused on financial. She's our JP Morgan Chase Deploy Fellow. Her capstone project for her fellowship is a project focused on foreign-born spouses, drawing from some of her experiences as a foreign-born spouse. And she created a survey and a white paper talking about the experiences of foreign-born military spouses, which is an area that we tiptoed into last year in the Military Family Lifestyle Survey, where we published finding on global citizens, looking at an overview of foreign-born military spouses, but she's really dug into that a little bit more. So we're looking forward to sharing that when that is ready to go. But it infiltrates all the pieces of Blue Star Families, as trying to bring in all the diversity of experiences. As we talked about on our panel, that our diversity is our strength, and being able to bring that not only to the military, but also to the work that we do is an important piece of the campaign for inclusion. Back to you, Brooke.
Thank you. Well, we are at the end of our time today, and it's been a
Brooke,
pleasure having. Yes, Ashley.
I'm so sorry to interrupt. I don't want to interrupt the closing, but I did just want to make a quick highlight about the policy work. I don't think I got quite everything in. And a shout out to Brooke, who is our Associate Director of Policy, who worked on the policy recommendations with me. We're really proud of the fact that the policy recommendations this year, or for this report, excuse me, address a lot of the instances of discrimination that we asked about in this report, but also have specific recommendation for schools, for localities, for states, as well as for individual military families, and highlight, to Rosie's point and Jess's point earlier, highlight some of the communities that are doing amazing work and are helping build those bridges to belonging. So I just want to encourage everyone to go check it out, because I think that this is a really innovative and unique approach to our efforts here. And then I know Jess highlighted it as well. Tomorrow as well, we'll be diving in deeper to some policy solutions. So looking forward to sharing those out as well, as we continue to advocate for just making sure that military families can thrive.
Thank you, Ashley. Much appreciated. Sometimes policy gets rather boring and dull for some people, but for us, we love it. And we know with the data that you all are collecting, that we can utilize this in our communities to drive policy solutions to help our families. Well, thank you. I'm going to pass it over to CT Moss for our closing.
Well, thank you everyone for joining us today for this data deep dive session. I hope you found it informative and engaging. This hour flew by, and we know that there was a lot of data to cover. We appreciate your active participation and insightful questions in the chat. We want to emphasize that our work towards equity and inclusion for diverse military families doesn't stop here. It's an ongoing effort that requires continuous research, collaboration, and action. We invite you to join us in this progress and continue the conversation in your own communities. Thank you again for being here today, and we look forward to connecting with you in all the future events.